The stories I'll tell you today are real experiences shared by doctors and nurses and truly unveil how close hospital workers are to the thin veil separating life and death. I worked in a small family run nursing home for 6 years as a nurse aide. It was an orphanage before it became a nursing home, and unfortunately, before being shut down, the orphanage had a history of severe abuse and neglect. When our residents get close to death, they always claim to see a little girl. One of my patients, a very alert gentleman, knew all our names and was very oriented. I happened to be passing dinner trays when I saw that he was facing the corner, talking and laughing. I knocked and asked him who he was talking to, and he chuckled and said, "This little girl came into my room. She was scared." I froze at that answer and, not wanting to scare him, just nodded and smiled. He died 3 days later. After about 6 months, I had another patient screaming about a little girl, grabbing his feet, saying that she needed to leave him alone. He died the same night. She's come up numerous times over the years, and it's always the same thing. They see her, and then they die. Other coworkers have had the same experience. It's very unsettling. I'm a psychiatric nurse. Early in my career, I worked at a residential mental health facility. There was a resident I'll call Marion Duquesne. He was an elective mute, which simply means that he didn't, couldn't, or wouldn't talk, but there were no pathological findings as to why. He had spoken earlier in his life and, in fact, seemed quite normal back then, with the notable exception of being close to 7 feet tall. He'd been raised in the Deep South and joined the military when he was 19. After boot camp, he was stationed somewhere in the South. One night, he just vanished. He was declared AWOL for years, and finally, he was declared missing and dead. 10 years later, a 7-foot-tall man walked into a VA hospital emergency room in my part of the Midwest and said to the receptionist, "My name is Marion Duquesne, and I've been dead for 10 years. Those were the last words he ever spoke. He was covered in dust and he was wearing the same clothes he'd been reported to be wearing the night he vanished. His social security number had not been used, and he had no identification on his person. However, they were able to identify him, I guess via fingerprints. He was well fed and in good health, except for his refusal to speak. The family was notified, but they said that they had already grieved their loss, and that whoever was claiming to be him simply could not be, and demanded not to be contacted again. Marion paced all day, every day, not in a frantic way, but just lumbering up and down the halls and outside. He smiled all the time and would be moving his mouth in a way that indicated talking or muttering, but he was dead silent. He had an unnerving habit of throwing his head back with his mouth wide open as if he were laughing heartily, but not even a breath could be heard. If told to go to the dining room for a meal, he'd go and eat. But if nobody told him, he just kept pacing, never indicating hunger. If offered a cigarette, he'd smoke it in an oddly formal way, almost delicately, if that makes sense. but he never seemed to crave smoking. The man wanted nothing. If I talked to him, he appeared to listen, periodically throwing his head back in that laughing, mimicking way of his. There was nothing to do for this man. Various medications were tried, but they did not affect him either positively or negatively. Occupational therapy did nothing because Marion would just grin, and unless told to stay put, he'd get up and start pacing again. On my last day at the job, on my way to something better, the last thing I saw was Marion, pacing in the parking lot, throwing his head back to laugh. Later I wondered if all along I'd been dealing with a ghost. All these years later, I honestly still don't know. I worked in geriatrics for years, so most of our patients died within a few years of being with us. I had a new patient move into one of the rooms where my previous patient had just passed in. My new patient kept calling at night, saying that there was this woman who kept coming into her room and trying to talk to her. At first, I just passed it off on her being in her 90s and struggling with dementia. So I assured her that I would lock her door at night to make sure no one would come in. After about a week of this continuing to happen, I sat down with her and was asking what this woman looked like, thinking she may just be hallucinating her daughter or sister or something. She proceeded to tell me that she had a pink robe on, with blue fuzzy slippers and her hair up in curlers, and that she would come in and sit at the foot of her bed, pat her feet, and try to talk to her, but she couldn't understand what she was saying. I was very shocked at this description. The patient that I had in that room prior to my new one went to bed every night in her pink house robe, blue slippers, and her hair in curlers, and my new patient had no way of knowing this. The visits continued happening for about 2 more weeks before abruptly stopping. I am a psychiatrist, and during my training years, I worked for 6 months at a ward treating patients with depressive and anxiety disorders. It was an old building that had been housing psychiatric patients since the mid-1920s. On our floor, we had 13 beds and a nursing station, a living room, and a few conference rooms. One day, a few weeks in, I'm interviewing a patient who, when asked about sleeping patterns, tells me she had heard a baby crying at night, waking her up. There are no babies in that hospital, as the place is situated far away from housing areas and there were restricted visiting hours. Afterwards, the nurse pulls me aside and tells me that the baby crying thing is not a psychotic symptom. She is very serious about this, but won't elaborate. I kind of shrug it off, as either way it doesn't change the diagnosis or treatment. Around 3 months in my stay, I'm sitting in the nurses' station and 3 nurses behind me are talking. One of them says, "She's very active today." And the other says, "Really? Oh, I hadn't noticed." I turn around and ask them who they are talking about. They look at each other, and then one of them hesitantly says, "Well, there is a baby here. She cries sometimes." I, of course, say no, but they just kind of shrug and smile. Not 30 seconds later, I hear it. A cry. A clear as day baby's cry, sounding like it's separated from us by maybe 2 or 3 walls. I'm perplexed and look at the nurses. I, of course, ask about this, but they can't say anything except this faint baby's cry is there and has been there always. Since then, I heard it maybe 2 or 3 times a week. I told a new doctor about it, who laughed. However, a few weeks in her stay, she came to me, white as a sheet, and told me she heard it in their coffee break. All the nurses just kind of knew about it, and being in psychiatry, hearing that kind of stuff is not really something you brag about. I was transferred and haven't heard it since. I think about it sometimes, but I don't really know what to make of it. My aunt used to work as a labor and delivery nurse, and I remember her telling this story to my mom once. She was working a shift where the woman she was assisting in childbirth had lost her grandmother, who she's never met, not long before her labor. In the middle of the frantic moaning and crying during delivery, the woman suddenly looked to a corner of the room, heaving and sweating. The only thing there was an empty chair. Nobody was there. She started talking to the coroner, seeming to respond to questions and generally just having a full-blown conversation with what seemed like herself. My aunt and the other nurses thought she was just delirious and tried to just soothe her through and ignore her. The woman's husband and her mother would try and calm her down and say, "There's no one there." But she would continue talking to the coroner. When she was out of labor and they gave her baby to hold, her mother and boyfriend were there, and she turned to her mom and smiled and asked, "Did you hear her earlier? Is your new life everything you imagined it to be? An adventure?" The mother was shocked. Apparently, the mother was an immigrant from China and left her parents behind for a life in the US. The last words the grandmother had spoken to the mother directly was, "I hope your new life is everything you imagine it will be, an adventure." The grandmother died soon after. She had never met her granddaughter, and there is no way the woman would have known the words she said. Thank you so much for listening to today's stories. Remember, if you haven't subscribed and turned on all notifications, your friendly neighborhood shadow person might just visit your house next. So go ahead and give this video a thumbs up as well, because you can never be too careful. Goodbye, Darklings.